The key here is bringing different people together to work at a solution that needs brain power to resolve it. These are not hard problems. They're just impossible to solve. How do we solve them? That becomes the challenge. And in a down environment, and foundations don't have as much money as we used to. So if portfolios are down, our response is going to be limited. That means that groups that thought they were addressing only one particular topic now will be asked to do more. And I turn to my co-panelists here in early childhood education and in the public schools to suggest that they are more than educators. They are now healthcare providers in many ways. So what is fed to children, what's taught to these children, what kind of immunizations we demand of these children, what kind of emotional and social support systems we provide them, what kind of recess and activities, all of these become kind of extraordinary responses. And they have to step up and recognize they're part of that solution, and we have to work with them to enable and empower them to reach those solutions.
Thanks so much to everybody. I think to begin this part of the conversation, maybe to further anchor us a little bit, Diana, I'm going to turn to you to talk a little bit about how families and children experience food insecurity. Say on a home visit, for example. A typical family who has issues with hunger, undernourishment, and food insecurity, what does that look like? What are the kinds of choices that they're making? What's in their fridge? What would you see if you went into that home?
Well, I think the first thing that we should remember is that none of this happens in isolation. So a family that is food insecure is probably insecure in a whole lot of other ways as well. So there may be some instability in terms of housing in general. So they may or may not be living, let's just talk about mom and baby. They may or may not be living in a place of their own or in a place that they can reliably stay for any period of time. It may or may not be warm enough, as Dr. Cook described. And more likely than not, there's other stressors in the environment and in the home. There may be anger, domestic violence, or substance abuse around as well. More likely than not, the community itself isn't terribly safe, and so the level of stress and anxiety that mom feels about her whole world is pretty enormous. And as a mother myself, I can't imagine anything more painful than knowing that you don't have enough food to feed your baby, because that has to feel like a tremendous burden and weight all the time. So when we look at the percentages of mothers in poverty who are depressed, and some of the studies have indicated that 50% of moms living in poverty are depressed, and for good reason. That's a rational response to their situation. But what that depression means is that mothers, and this is true of fathers too, I don't mean to exclude fathers, although we know that the burden of caring for young babies is primarily on mothers. But these are mothers who, because of their circumstances, are less likely to be able to pick up their baby's cues and respond to their baby appropriately. Perhaps because if their baby's hungry or cold, they can't do as much about that as they might like, or if their baby's frightened. We know that the responses that children get to everything that they do, whether it's a gurgle, a laugh, a cry, a smile, there are thousands and thousands of those responses. And as Dr. Cook showed in his slides, the way that we all create the neural highways in our brain is through millions of interactions with other people, and primarily with the people who raise us. And those interactions shape who we are and how we view the world. So I think it's important when home visitors come into the home, the first thing that they're doing is trying to think about that relationship between the mom and baby, and food becomes a critical means. It is the critical means by which that relationship is formed. One of the most important things that we know we can do to improve babies' health is to encourage moms to breastfeed. That requires that we give them enough food to be able to produce milk. And it also means that we want to ensure that mom understands the healthy reactions and interactions of what her baby's asking for and how to meet those needs. Mothers who can't meet their baby's needs often don't respond appropriately, and I would sometimes include myself in that category, so I don't think this is just about mothers in poverty. All of us become frustrated if we can't do what our children need, and in periods of increased absence of being able to meet needs, mothers don't always respond appropriately, and they end up with children who don't understand how to respond appropriately.
Yeah, and of course, as we've been hearing all morning, that has consequences by the time they enter school from the very first days. I wonder, Sarah, well, anyone really, if you could talk a little bit about how that begins to play out in the classroom. I mean, Sarah, you talked a little bit about hunger impacting a child's progress on that slope. How do you, I mean, there's so many factors that impact that, right? How do you pull out the nutrition and food security issues? How might school personnel, a counselor, a teacher, someone understand that that is an issue in the home, and because there could be any number of things at work. What are the signs, the indicators? What are you looking for?
Yeah, I mean, I think, part of the challenge for us is we have almost 700 schools across the city. So we have 26 chief area officers who are, in essence, deputy superintendents. Each of them has a portfolio of schools that is larger than like 80% of all school districts in this country. So just to give you a sense of scope and size. So what we expect of our principals and of our school-based personnel is that they are making decisions, and that they are looking at the information, and that they are dealing with the issues in the environment in their schools on a very proactive basis. We know we have to do more to give them tools to be able to do that, and of course, any of you who have visited a school anywhere know that there is any number and myriad of issues that are happening in those buildings from time to time. We believe that our best stake in the ground from a central perspective, so now remember, we're like, a couple of people in a big building downtown somewhere, but there's 700 schools where there's actually real stuff going on every day with lots and lots of students. We believe our best stake in the ground is to have a system in which we can ensure that we know where students are at. Beyond that, there's only so much we can do from a central level. So the chief area officers working with principals, and this is where we get into, I think, a lot of this conversation about central versus decentral, institutional versus local, and where we think money and resources and effort is more likely to institutionalize and to take root and to actually have a chance of making really good progress and having lasting impact. Comes through. We have seen pockets of enormous innovation and really, really, really deep creativity in schools around all sorts of issues, right? And food service and nutrition is just one of them. The pilot programs that the Food Depository here is doing with some of our principals on a very, at this point, relatively small scale are examples of principals and school-based leaders who care tremendously about very specific issue of nutrition and food security in their school, and see that as a way to bridge all kinds of other issues and all kinds of other aspects of learning in that school. We have to, from my perspective, it's almost it has to be a grassroots perspective, because I can talk till I'm blue in the face about what principals should do, but it's only as effective as being able to actually provide services and tools and really have an accountability system that ensures that students are on track, and that if nutrition or whatever the issue is the primary issue in that school or with that student, that it's being addressed. It's kind of a bureaucratic answer, but I think that part of the challenge has been we have believed that bureaucratic answers would solve very local problems, and I think we need to get more local.
I'd like to add to that. One of my frustrations as a funder is that good programs are developed and cannot be implemented. I am a big supporter of universal breakfast in the classroom. CPS gets that. And we have janitors in the system who don't want to clean up around universal breakfast in the classroom. Now, if you've been hired as a janitor, I bet your job description may say somewhere in it, clean up. But they have a veto over whether children eat breakfast in some school buildings in Chicago. And I think that is not only unfortunate, I think it's unacceptable. And I know central office can only do so much, but if a principal and a janitor have a veto over a hungry child's destiny, brain development and all the rest, how are we ever going to raise educational standards and achievements if the child is hungry and is going to be malnourished and basically brain nourished deprived? We learned all that this morning. We know what some of the answers could be. It's not that a breakfast will magically fix other problems, but if we can chip away at all the obstacles, maybe we get to the solutions. In the schools where universal breakfast has been introduced, you look at McAuliffe School, reading scores went up, discipline issues went down. It's not hard to understand those cause and effect relationships. In schools where children have oral health screenings, tooth decay is less of a problem, absenteeism goes down. In schools with high rate of asthmatic children, probably 10 years ago now, we introduced new legislation in Chicago so that a child could use their inhaler in the school. If you have an asthma attack, you need your meds. If you don't get your meds, you're going to have a problem with attendance. You're going to be sick for several days. You can't learn if you're not in school. We changed those rules so children could have their medicine. We're trying to change those rules so children can eat. But the system itself thinks it's an educational system, and it is, but it also now inherits other responsibilities, which many people in the system are slow to understand, are part of the deal. And if the parks become a place to eat as well as to play, if the Y becomes a place to eat as well as to exercise, we will then have a messier environment. These organizations can't be as easily typed, but we're all going to be better, and probably the solutions will be more affordable because we've shared the burden, we've spread the burden over a lot of institutions that can deliver these services more cost effectively. So it's a little messy, but to me, that's the way we're going to have smarter kids if they're healthier and also better fed.
Can I just tack on? There's a proverb that says, when there is food on the table, there are many problems. But when there is no food on the table, there is only one problem. I think our schools are set up to deal with many problems. They shouldn't have to deal with hunger. And while I agree, I am so excited to see the progress with Louise leading the charge. We still have only 34% of the children who are eligible getting breakfast in the city of Chicago. And to all of you in the room, I would say, where's the outrage? Every one of you lives someplace, and I would venture that someplace near where you live there is a school. And I would ask you to find out if that school provides breakfast. Part of the reason that principals and janitors and the administrators and the local school councils don't feel the burning need to provide breakfast in the classroom is because they're not hearing from the neighborhood constituents that this is a priority, right? We need to tell our school leaders that it is a priority, that when children walk into their first class of the day and they're struggling learning algebra or learning to read or learning social studies or trying to understand geography, the one thing they shouldn't have to worry about is whether or not they have had something to eat.